The pain got so bad in my hips that walking was just really painful. So I knew something had to be done. The pain in my bad hip was so bad that I couldn't even go grocery shop without using the cart.
I love this place so much that I would bring any family member here, and of course I brought my dad.
I think the reason I decided to come here was my son's connection and his thought of the high care here.
My dad was going to have a hip surgery. It's an anterior approach. We do probably 5 of them a day.
This is a very safe procedure. It's one of the more common operations we do. Mr. Matt's surgery went very, very well. We were very pleased. His leg lengths were good. His intraoperative course was very stable, and he was taken to recovery room in very good condition.
After his hip replacement, he was very lethargic and was unable to be aroused.
And I started seeing a lot of our staff rushing into PACU, and that's when I knew something was wrong.
When I evaluated him in the PACU, he was found to have hypercapnia, meaning he was retaining carbon dioxide.
It was very serious. He was close to not making it. I knew that he was in great hands. I knew that he was going to make it. It was very scary, but I knew my team was going to take care of him.
We have to get rid of the CO2 somehow. So he remained on the ventilator, and we adjusted the vent settings to get rid of the carbon dioxide level, adjusted rate and tidal volume and everything. And again, after he was extubated is when we really kind of found out that all his symptoms were related to his undiagnosed obstructive sleep apnea.
It's kind of traumatic waking up that way with all 3 of my kids in the room looking scared. But I got through it, and so the care here was tremendous.
And my dad went to Dr. Shaw and got a sleep study done and got a CPAP, and he actually wore the mask on his second surgery, which the second surgery went amazingly.
Florida Hospital Wesley Chapel was very proactive in trying to identify how we can preoperatively screen patients who might be at risk for sleep apnea because of the problems that Mr. Matt experienced.
The team in critical care was amazing. They did an amazing job. They took care of my dad.
The main reason I came here initially was because of the facility and the grounds and the OR and the technology that they had. The reason why I've stayed here is because of the people and the teams. It's an amazing nursing team. It's an amazing OR team.
I just want to say thank you to everybody. Thank you to the OR staff. Thank you to all of my PACU nurses and friends, even pre-op, all my anesthesia friends, even PICU and everywhere. The whole hospital really teamed up and supported me through my troubling time, but also my dad's. It's very scary. My dad was thinking about having surgery in Fort Myers and at a surgery center or at another hospital, and I know this team, I know this hospital, and I know that we have a great team, and we have pulmonologists on staff. We have critical care on staff that could come in at any moment if anything does go awry. The team that we have, I think, saved his life.